Once again, my name is Kisembo Calvin. I'm a qualified and experienced speech and language therapist for about 6 years. And I serve also as the president of the Ugandan Association of Speech and Language Therapists. Yeah, back to the question, the common barriers to early diagnosis and intervention for autism in health and community systems in Uganda. I'd like to say, before I just dive into exactly what I'm supposed to do this morning, that these barriers are multifactorial. We can identify them as community-based barriers, health system barriers, and also education barriers, because when this child is born in the community, and they are seeking a behavior. The first one goes to the health system. And then later, when they go back to the community, as they grow like other children, they also go into the education system. So these barriers are multifactorial, as I'm going to highlight them. But they are not limited to what I'm going to say this morning, but I will highlight some specific one I really thought they would be very important for us to identify this morning. One of the biggest barriers I see is stigma, cultural beliefs, and also low community awareness. Yeah, as just to add on what the clinical psychologist just added. In our communities, there are many cultural beliefs about disability or about children who are born in a specific way or children who are growing in a specific way. There are a lot of cultural beliefs and myths and misconceptions. So all these build up stigma, and also due to low community awareness about these conditions, especially in the remote areas, may really cause a big barrier to early diagnosis. And then the other thing I would also like to share, there are limited specialists. I think by experience, for example, for us from the speech and language therapist, we are very few speech therapists in the country. And when you are to distribute them actually in the district of the country, you may even fail to have one therapist to be in one district of Uganda. So you are going to see that due to inadequate specialists, and also when you look at the diagnosis, there are some specific professionals who are really mandated to do the diagnosis, like the clinical psychologist, the neurologist, who are supposed to do the initial diagnosis. So when you look around in our communities and also in the health systems, they are very, very few in number. So this creates a very big barrier in early diagnosis. Then the other factor I could also highlight this morning is the inadequate policy and infrastructure framework, just as the psychologist highlighted, that the diagnostic criteria that they follow and the standard test that they follow. In Uganda here, we are just trying to borrow from other countries. We have not established standard diagnostic criteria for our country in our contexts. You're going to find that some diagnostic materials are set for one language. For example, they will say this material should be only used for people where English is their first language. Now, when you look at our environment in Uganda, we have very many languages, we have very many tribes. So you may find that some of these may not really work in our context. So due to that, it becomes a barrier to really to have early diagnosis. Not only that, we can also see that the policies, for example, about even in our health systems, are there these specialists in all the health system, for example, up to the Uganda health centers, from health center 3, health center 4, district hospital, regional referral, the national referral hospitals. We may find that there are really no specialists and also these criteria. Even if the criterion or the diagnostic materials are there, even the people to implement them are really not there. So this creates a very, very big barrier in early diagnosis. And also, not forgetting that resources. We are living in a low income status. Even our people are really struggling financially. And yet when you look at most of these rehabilitation services are costly. I think the mothers or the parents here who are really raising children with autism can really testify that these services are very costly. And that is a very big barrier to diagnosis and early intervention. To continue, I would also want to highlight specifically in the health system. And with an example, in April, I participated in Autism Run in Mbarara. Autism Run in Mbarara. And I happened to really interact with the doctors from Mbarara Regional Referral Hospital. They are really have no way to help people with developmental neurological conditions. In summary, they have no capacity to handle people with disability. So we can see also another barrier to early diagnosis and intervention is our public health system has challenges. Where there are no specialists handling these conditions, especially in our public health system, because we know that the public health system goes up to the sub-county level. And the private health system, they are trying, because you find that they are recruiting therapists and working with therapists, especially in urban areas. But because most of our people are poor, and also town is very far. Imagine someone to move from Barara, from Kotido, to move from Arua, from Busia, to come to Kampala to receive these services. You could see that big barrier for them to have that diagnosis at an early stage in life. So then also the other barrier that we can see. I say that the barriers are very many, but I'm about to conclude on the one I highlighted, which are really very, very common, and I believe that you're also facing them, or you face them at some point. Another thing, because we are looking at barriers in diagnosis and intervention. And when you look at intervention, especially for children who are growing with autism, they must be in school. And I think you can testify that. They must be in school because they are growing like any other child. They must be in school. But when you look at our school structures, really, most of our school structures are not inclusive at all. And even when this child comes to this school, like for example, nowadays children go to school at a very early age, about 2.5, 3 years, they're already in school, and that is a very good age for early diagnosis. But you find that the teachers there do not have any idea about autism or about any other disability. So this is a very great, very big barrier. Yesterday, one of my colleagues, I worked with her as a special needs teacher at some school where I was working. You would see that she called me. They had a discussion in a school. It is a public school where in her class they are handling over 200 students. And in that class they have over 10 children who have autism. So, and then the fellow teacher was arguing about a child is in primary 4, they cannot settle, they cannot read, they cannot write. And then the other colleague said, no, these children are gifted, they are just gifted, that's why they're not able to write and read and study. And yet we know that these children may not follow the typical curriculum for a mainstream, but they have special skills that can help them learn something wherever they are. And I'm sure we are, this team here, I know people who are here are not so green about what I'm talking about, but you could see that even in the education system, especially with early intervention, most of our children are neglected in schools. Me, I've tried to work with many schools, supporting many schools around Kampala, Wakiso, Mukono, and Impigi. But you would find most people do not know about these challenges, about autism. So I think education system has a lot of barrier, especially when it comes to intervention for children with autism. I've talked about early costs of, high costs of assessment and intervention, and also urbanization of rehabilitation services. So most of the rehabilitation services are around urban settings. What about that person in Koboko, for example, in Alebutong, Kaperebyong, someone in Kisoro, in Bundibugi or in Kasese? How will they come to Kampala or Wakiso where these services are? Don't you think that this is a very big barrier? I think it is a very big barrier. So as I said that when I was starting, that the barriers to early diagnosis and intervention for autism in community and early system are multifactorial. There are many factors around that. And I said they are not limited to what I've said, but these are the common ones that we are really facing in our communities. And I'm sure when all these are handled, we shall have an inclusive environment where there is early diagnosis, and early diagnosis leads to early intervention. So as the psychologist was highlighting, that there is a critical age for these children to learn. As you see that children develop milestone depending on age. At a particular age, there is a particular milestone that is being developed. So when this child misses diagnosis, let me say up to 8 years, you understand? And scientifically it has been proven, and when you read the papers, that for speech and language development, there will be better chances, or there are better opportunities for a child to recover, to gain speech within the first 6 years. You understand? So if this child misses the first critical 6 years, where we normally refer it to the neuroplasticity of the brain, where the brain is still flexible, you understand? Where the brain is still flexible to learn. So meaning this child is going to miss out. Just as the opening remarks say that sometimes communication or speech becomes a big challenge. But I'm telling you, with early intervention, our children can learn. And I'm sure I have worked with many people, maybe some of them are here. I am sure with early intervention, early diagnosis and early intervention, our children can live and learn many skills.